All right, guys, in chapter 6, we're going to talk about serial killers in healthcare situations or healthcare killers. So, these types of serial killers are rare, but they're generally very prolific in their killing. So, we can break down here. This is American healthcare providers that were charged with killing or attempting to kill patients between 1970 and 2004. You can see 2/3 are nurses, about a fifth are nurses' aides, and just over 10% are doctors. Keep in mind, as you can see down here in the bottom, that the N is 41, so our sample size is 41. 41 American healthcare workers were charged with killing or attempting to kill patients in this 34-year period. So there's this study called the Yorker and Field study, and they examined 90 cases of serial murder, and they looked at them from a global perspective. And they found that the typical scenario involved a common injectable substance as the method of killing. The deaths tend to cluster on the night shift. And if you sat down and looked at which providers were present, specific care providers start to show up over and over again. Now, they did differentiate between cases that appear to be actual authentic euthanasia versus where the killer had another motive. In about half of the cases, the killer was convicted of serial murder, and another 24 were indicted for serial murder as well. Okay, so out of 90 cases, about 86% of their cases involved nursing personnel, and women were involved in just over half of the cases. The majority of the murders occurred in hospital settings, and victims were most likely to be critically ill, very young or very old, or with apparent vulnerabilities. And again, injections were the most common way to kill, but it was also not uncommon for multiple methods to be used. Now, Vicki Dawn Jackson, 36-year-old vocational nurse in Texas, over about a year or two period, injected elderly patients at Nocona General Hospital with lethal doses of mercurium chloride. At least 10 patients died, and investigators believe that she was probably involved in more. Donald Harvey killed at least 50, that's a 57 patients. He was a hospital orderly, and he said he killed them out of mercy to ease their suffering. Now, Lamp, who's a researcher, refers to these types of killers as experiencing the Mother Teresa syndrome. These are people that often have narcissistic personalities, hero fantasies, and a need to control others. Now, needy people often make poor choices, and in some cases, as caregivers, patients become proxies in order to assuage feelings of low self-esteem. The need to help then becomes a compulsion, and in its extreme, that's manifested in acts of murder. Now, looking at the methods of murder that were in this Yorker and Field study, as you can see, a little over half are injections. In about a quarter of cases, they don't really know what caused the death. But then you can see suffocation is the next most common one. And then we've got a variety of other methods of killing here. Now, in the US, licensed nurses who used injections administered medications like insulin, epinephrine, or potassium chloride into an IV line. Nurses in Europe were much more likely to use morphine. Nurses' aides were more likely to suffocate, use poisons, or administer oral medications. Now, these healthcare providers who killed their patients are often diagnosed with Munchausen syndrome. So here are some of the poisons that were commonly used, okay? And as you can see, these are a variety of different drugs, right? Digoxin is a drug for the heart, and it's used to improve the pumping ability of the heart, and it can be used to normalize some dysrhythmias. Potassium chloride, this usually leads to cardiac dysrhythmias and arrests. It's a prescription drug. It's used to replace potassium in people who have low levels of potassium. Adrenaline is a hormone that we produce naturally, right, by the adrenal gland, and its purpose is to release neurotransmitters into the bloodstream to increase the heart activity and increase the rate and depth of breathing. Succinylcholine is particularly concerning because it's hard to to trace unless you know you're looking for it. This is a neuromuscular paralytic agent, and it's, as I said, relatively undetectable. It's often used as an anesthetic to relax muscles during surgery. And I'm sure you've all heard about fentanyl because fentanyl has become a drug of abuse as well. It's 80 times more powerful than morphine. It's odorless and tasteless. So here we can see a breakdown specifically of those drugs, right? So in the prior breakdown, we saw that 52% of the deaths were caused by injectables. Here's a breakdown of what those injectables look like, right? So opiates, that's where fentanyl would fall, right? So we see opiates, potassium chloride, that's KCl. And those are the two biggest ones there. The rest are all really small percentages. Now, several offenders had injected themselves, right? And this way, then when people start to get suspicious, they don't look like they're the perpetrator. Others were sadistic and enjoyed the power they had. Some financially profited from their murders. Some see themselves as angels of death, that they're providing a merciful release and a mercy killing of a terminally ill patient, someone who is suffering. But again, these types of killers are rare among serial killers. Now, why are we seeing some increases in murders in nursing homes and healthcare facilities? Well, victims are accessible and vulnerable, and an offender can operate easily without really being noticed. The offender has an access to a variety of murder weapons that can easily be disposed of. When someone dies in a hospital, especially if they were terminally ill, an autopsy generally is not performed. People routinely die in hospitals, and so we're generally not suspicious of that. Supervisors and administrators also probably don't want word to get out that this has happened in their hospital, that someone's being suspicious or someone's harming patients. And so they avoid negative publicity at all costs. And finally, prosecuting people who are believed to be involved in the deaths of patients can be very difficult. Evidence might be lost, there might be a lot of sensationalism, and then, of course, we have to deal with all the legal procedures. So what are some red flags for nurse supervisors? You're going to see the next two slides have a long list, and I'm just going to point out a few of them. Patient deaths are unexpected by staff or family. Family was not at the patient's bedside. What else do we have? Fellow employees often report allegations to investigators and not management. There's no eyewitnesses. The weapon of choice is usually a sudden death chemical, which is readily available and often not detected or not routinely tested for in an autopsy. The subjects, right, our offenders are often charming and friendly. They often have good written reviews from their supervisors, but prior employment records might show questionable incidents. Drugs, poisons, and related books are found in the subject's home. The subject insists the patients died of natural causes and never shows remorse. And the subject craves notoriety.